Hi friends, good evening. I'm Dr. Ashutosh Gupta, and let us talk about the inflammatory bowel disease, whether this could be a lactose intolerance or could be an autoimmunity or could be an inflammatory bowel disease and the pregnancy, right? So I had been following up this celiac disease for a pretty long time, and very recently I came across a pregnancy with the celiac disease. The astonishing part is this that the couple, both the father and the mother, both are medical professionals, right? So, meaning thereby, now let us talk about the celiac disease as a matter of fact, right? Okay, so this is an autoimmune condition and leading to inflammatory response, inflammation, venous atrophy in the gut, and leading to sort of a nutritional deficiencies and thus placental dysfunctions, leading to a situation like a preeclampsia from very beginning, from the very early beginning, simultaneously with a nutritional deficiency to the mother, and thus leading to a sort of an very severe or miscarriages, increased risk for the miscarriages and severe growth restriction to the baby, very high risk for a preeclampsia and preterm births, leading to sort of an NICU admissions, right, and a nutritional deficiency to the mother. So let us discuss this one case, and then probably we'll discuss how do we manage all these cases. So this is the index case, which we are seeing at 18 weeks. So both the uterinating Dopplers, right and the left, both are abnormal with a post-diastolic notch. So very high risk for a preeclampsia. Now, celiac disease, as I've told you, could be 1% in general population, right? Could lead to miscarriages, infertility, preterm births, low birth weight, preeclampsias. Lactose intolerance can have bloating and sort of, but this could be quite manageable. Inflammatory bowel disease, yes, definitely they are very rare, but this could be with biologics and with some drugs, they could be managed. Celiac disease, definitely it can lead to immune deficiency, placental dysfunctions, abnormal Dopplers, right? And therefore can lead to preterm births, preeclampsia, SGA, small for gestational age babies, right? And stillborn babies. So very strict diet control. And so the identification of the celiac disease simultaneously with the pregnancy or a pre-pregnancy is of utmost importance, right? Once we identify that somebody is dealing with a celiac disease, is having a celiac disease, the management definitely changes. So then she becomes a very high risk for an iron deficiency anemia, for a nutritional deficiency, and for a preeclampsia starting from 12 weeks onwards. So probably we would not wish to miss on to this golden period of starting up with some drugs by which we can manage the blood flow. So probably she starts. So probably we are very sure about her diet, which is free from gluten. We'll give her all the nutrition supplements. We'll keep her very strong sort of a suspicion to start up with a preeclampsia for a miscarriages for stillborn babies, for placental dysfunctions leading to abnormal Dopplers as early as 18 weeks, right? So and probably we would wish to start up with this low molecular weight heparin and equaspirin as soon as possible, and to follow her up very stringently so as to see that are they small for gestational age and the preeclampsias. So we are able to pick them up very early, and we could manage all these things very nicely with the nutrition supplement and with a very strict diet, right? So that is how it is. So celiac disease is a very high risk in which we can have 3 to 6%, 3 to 6 fold increased risk for all these things, whether it could be spontaneous abortions, could be in stillborn babies, could be in low birth weight babies, could be preeclampsias, could be small for gestational age babies, and so on and so forth, right? So celiac disease in a pregnancy could be managed very well, and so meaning thereby that this becomes a very high risk case and needs a very specialized sort of a management and surveillance, right? Thank you very much for your patient listening.